Hello and welcome to Weekend Gist with Rachel Langs on Haskell TV, where you get entertained, educated. And so today, we're going to travel through the journey of a nurse. With me here, I have a guest with me in the studio. And of course, you know my name already. I am Rachel Langs, and you?
Nurse Divine just one me.
Okay, alright, you can actually call the other one, but Nurse Divine. Alright, so I have with me here Nurse Divine. And so we're going to travel through his journey to nursing and I don't know the other nursing and health whatsoever. Alright, so Divine, thank you for having you in here with me. Thank you for honoring my invitation. Yeah, so first of all, before I ask you my first question, we have a lot of career out there, businesses that young people do to actually fetch them huge of money in just twinkle of an eye. So why do you decide to go for this? Why? And so now I'm linking it to my first question. Can you now tell us about your journey into nursing and what inspired you to choose this profession?
Thank you very much for this question. I really appreciate you because what actually inspired me to do nursing was coming from the fact that when I was still a child, I for sure was not having the intention of doing nursing.
Okay.
I grew up with the intention of I wanted to be a pilot, not knowing pilot was not a career to choose.
Why did you say so? A lot of pilots are out there listening to you.
Are you sure they went to school? They went to a different school. So I grew up, I thought I was going to be a pilot only to change to engineering. I wrote JAM and then before I could realize I went to Kaduna for Air Force training. It did not work. I was just at home doing nothing. So I decided to apply College of Nursing Sciences, Jalingo, and then God did it. I got admission. Now, nursing was not part of my calling. It wasn't part of me. I just decided to see how I can further start something somewhere. So before I could realize I was in College of Nursing, I fell in love with that school. I fell in love with nursing after all the frustration at home. So because I decided to do nursing, only to discover that was my calling. Yes. And then here am I today. I'm in love with nursing and I forever want to be a nurse. I want to be the first professor in nursing to be in my family, if God will allow me.
Wow. Okay, so now can we now say that this is not just love at first sight for this your career of a thing? This is something that has to do with divine arrangement of the God, just as your name is divine. Actually, hindrances came, but it was just for your good. Can we describe this your situation as divine arrangement? All right. So moving ahead to the second question: what does a typical day look like for you as a nurse, and what are some of the biggest challenges you face?
Yes, as a nurse, our day begins, especially for those that are working in the hospital, our day begins by probably trying to see how you can arrange your patient on beds, you can see how to give them, serve their medication and all that. But now, nursing is not just focused in the hospital. Let's talk about people out there like maybe home care visit and all those kind of level of treatment. So now, in nursing, there are some few challenges we have. The kind of challenges me personally I face is that you see, you may give a patient a personal kind of because nursing, what we do is we give emotional care, physical care, intellectual care, spiritual care, and everything. I know what I'm saying. All in all. Now, people tend to, the challenge I'm facing personally is that when you give people emotional care, you treat them as if they are part of you. They later turn it against you. Maybe your patient will start liking you and all that. So if you think about it, how many patients are out there and then how many are you supposed to treat to fall in love with? Then those are the challenges we have. Then another challenge
for a young nurse like you,
I'm telling you.
Okay.
Even some old nurse, they never want. They're suffering, especially the male. Because it's very difficult for a female nurse to just. Most of the female nurses, especially the ones that know what they're doing, are already matured. The young ones, they they play too much, they don't graduate. I'm sorry to say that. But we have smart ones that are actually graduating. So the challenge is just very simple. Another challenge I have is that maybe you're treating the patient and then you can just try to seize opportunity, even because of the professional level of knowledge, want to respect yourself. You can be with a patient in a hospital, then only you and the patient, and this is a female patient. You may choose to just take advantage, but because of how unique we are, there's this level of control that we control ourselves to see that things are okay.
Okay.
Yes, those are the few challenges we have. We have a lot of challenges, but those are the few.
Okay, but these are the few that you choose to mention in here. All right, so many people see nurses as a backbone of healthcare. What does that personally, what does that responsibility means to you personally, like a backbone? You are our strength.
Okay.
Well, how true is that when we have God in heaven?
Yes, it is, you know. It's true. Somebody said after God is in nursing, because this is what actually happened. I can believe with you that yes, they are the backbone, not because we have pride, but because in reality, this is how life is. You know, in the hospital, we are the backbone, I can say, because we are always with our patient. 247. If a nurse leaves the hospital, it means another one is coming to replace. But sorry to mention profession. Doctors, let's say some hospitals around, they go for ward round just twice or thrice a week. But patients are always with our nurses are always with our patient. Now, you see that even Sunday morning, when we're supposed to go to church, at times we have morning shift and we must attend. So what I'm indirectly trying to say is that we are part of the backbone, because doctors are also in their own profession backbone. Everybody are in their profession.
You're contributing in your own quarter, kind of your own way.
Yes, but if you allow me, I can beat my chest to say we have a lion's share of it. So they can also brag on their lion's share. But as a nurse, I'm bragging on our lion's share of the backbone.
Wow. All right. So moving ahead, what are some common health mistakes people make in their daily lives that nurses often see?
Yes, there are a lot of things people are actually doing that I just look at them and say, oh, that's why you're always in the hospital. You see, some common mistakes like exercise. Exercise, common exercise. You can just wake up in the morning and then run a 30-minute exercise, jump up, do this and that, just a little exercise. Not necessarily stressing yourself. Yeah, the stress is also part of what we're talking about. So people tend to stress themselves so much that they keep walking, even if they're pregnant, they are not pregnant, they're supposed to walk, they're just walking and then they keep stressing. Before you realize later you have headache and all that, you just be stressing yourself. Those are some little. And then we have drug abuse. Okay. Drug abuse are also common mistakes. Yes, we have drug abuse. We have poverty is also a mistake. Yes, I know why I said poverty because I'm supposed to tackle the issue of poverty because some common mistakes from poverty is that they can rush you to the hospital. I bet you if you don't deposit, they won't even see you. They're not seeing you without your money. That is in reality. Not because they really don't want to help, but because that is just a culture that guides the whole process. So another one thing is harmful traditional practice. Harmful traditional practice where mothers, breastfeeding mothers or lactating, we call them lactating mothers. Now, what they do is their first breast milk, they tend to pour it away, which is the most important. That's the major thing. It's better you give your child that and continue with a different formula than to focus on them on wasting the first breast milk. Yes. So those are the little things. And there's some people who depend on what sugary food, all these junk. They like things that are very sweet. All that. Those are the common mistakes we see. Yeah. Okay. Though I love sugar too. Those things.
Alright, in your experience, how important is preventive care, and what simple steps can people take to stay healthy?
Okay, for preventive care is very important because you see, more reason why they came up with vaccine for COVID-19, vaccine for this, hepatitis B. You know, there's a saying that said prevention is better than cure, but me, I title it prevention is far better than cure, because in prevention it will save you a lot of financial stress, you know, because if you prevent yourself from a particular illness, you are not expecting that disease to come. You understand? So you need to just prevent yourself. If it's in time of vaccine, you take your vaccine, just prevent yourself, and then that is just the best thing. Now, there are some common things we do to prevent ourselves. Staying hydrated, drinking a lot of water. I will advise you to keep taking water. You know, in our day-to-day life, people neglect taking water. Some people, places like Gembu, because Gembu is very cold, people forget to take water. Now, this kind of places, how it's going to affect you is that you start drying from inside before the dehydration brings your skin will start drying, because your inner part is now or the internal part of your body are getting dry because they need a lot of water. Stay hydrated and all that. Now also checkups, medical checkups, regular checkups. You visit your doctors. For women that are pregnant, you go for antenatal care. Those are preventive measures. Yes, you go for antenatal care and all that. So those are a little one for now. There are a lot of preventive measures, and for nurses you use what we call PPE, personal protective equipment, like gloves, masks, the apron, and so on and so forth. We have them, a lot of them.
Okay. Alright, thank you very much. Alright, at this point, let's take a very short break. When we return, the program will continue. Don't go anywhere. Stay tuned. Welcome back from that short break. And if you're just joining us, this is Weekend Gist with Rachel Lance on Haske TV. And of course, today we're discussing, we're traveling through the journey of a nurse Divine here with me at the studio. And we've discussed a lot, and then we are going to continue from where we stopped. Alright, so the next question is, what role does communication play between nurses and patients, and why is it very important for that communication in between nurses and patients?
Yeah, communication is very paramount. Very, very important. It's the key, most important role we need to play in nursing. Because you see, in nursing we have what we call, your first impression matters to your patient. When a client walks into the hospital, or if you meet your client out there, the first thing you do in nursing is you create what we call therapeutic interpersonal relationship with them. By creating this therapeutic interpersonal relationship with them is by what? Creating rapport. That's having a what? Conversation with them. Through this conversation, you're going to ask them some few harmless questions that will guide you through your treatment. Now, in treatment, you must know what is wrong with your patient before you start the treatment. I cannot just present myself and then you start treatment. No. But when we have that conversation with our patients or client, from there we will know what to do and what not to do. Then, it also guides you to know the background or where the illness or disease is coming from. You understand? So, through conversation, there's something we do in nursing to tell you how important communication is. If you cannot speak English and I cannot speak Hausa, and that's the only two languages you and I could communicate with, what we'll do is, since I speak English, I invite an interpreter that will understands Hausa and English. So I will speak to him, he talk to my patient or client, then
it becomes your mediator.
Yes, so that is how important communication is to nursing. Now there are stubborn patients that they really don't want to talk. They really don't want to talk personally. Use any medium, they will not still talk. There's how we used to follow up in communication. Now you involve the imam for the Muslims or the pastors for the Christians. That is where you will get more information. When they are pastors, except if they don't respect their imams and pastors, but if they respect them, they will definitely talk to them, then they reply to you. But communication is very, very important in nursing. Without communication, indirectly nursing, we are losing a very big part in nursing.
Okay, that's interesting. Alright, so the next one is there a lot of myths about healthcare. What is that misconception, that one misconception that you've heard about nurses? You've heard people talking about it, like nurses are this, nurses are that. So today you want to correct that misconception, that thing that people are saying that is not true. That you are inside, you are the one wearing the shoes, and so you know where it hurts and where it pinches. So please, what is that thing that you think is not right that people are saying about nurses?
Okay, since you are giving me a chance to just say one, I won't say the other ones. I'll just say the simple one that it looks simple, but it's not something that is true because you see, people tend to believe that nurses are supposed to focus strictly in the hospital setting. They're not supposed to be out there. And then people also believe that nurses waste their time or they don't have time for themselves, which is not true. We have time for ourselves because that is why we have morning shift, afternoon shift, and evening shift. If I go for morning shift, I'm expecting my next colleague to take over from where I stopped. And I promise you that we used to give the same level of treatment. You understand? So people believe we focus on just hospital work. No, but the truth is we have right to work anywhere in the school setting, community setting, because in the community we can give health help. It is our duty. Though public health are there to advocate for the people, they are there to speak to the people. But we nurses, we also give health help in our own end. So we have a bigger role to play. We have roles to play in churches. I've seen bigger churches where they have what we call
medical outreach.
Yeah, no. We have what we call sick bay. For emergency treatment. So we don't just focus strictly at the hospital. We also have places out there to work, which is very
also
important.
outside the hospital.
Yes.
Okay. So what about this one that I heard that nurses are actually wicked?
Okay.
Okay, now yes, that nurses are actually very wicked. Like they can talk to you anyhow. They sold you. In fact, they say take this drug, and then you're kind of a person that don't like taking drugs, and then you're doing shakara the way he sold you. And now moving to probably you are not a midwife, are you?
Okay.
So now when we go to labor room. I hear say where did the floor woman there?
Okay.
Do you have anything to say about that?
Yes, I've heard of that too, and I want to consider this question because it's touching. You asked me of one, and I've answered the one.
Yeah.
But let me consider this one because it's touching. Yes, people, we have individual differences. If you walk out there, even people that are not nursing, there are people that are naturally in your family. There are people that are naturally friendly.
Yeah.
There are people that are naturally harsh. Not everybody are having the same level of treatment. So it's just as the same as one of my brother, which is simple, go to nursing school and then graduate, he will still have wear that attitude of niceness. But the bad one will still come up with a bad attitude.
With the harsh behavior.
So it's not just the nurse itself, but
it's just an individual
attitude
behavior
that you came out with from your family, I believe. So sorry to mention family name because it's true. It's true. They don't teach us to be mad at people or harsh at people in the school. So my patient always loved me, I must say. So I don't know. I've not experienced that before though.
Alright, so thank you very much for that beautiful answer. Alright, so moving ahead. What advice would you give to young people who are considering a career in nursing?
Okay.
Not those that want to go for soldier, army, pilot, and then a lot of things happen, and then they now find themselves like, let me just take this one.
Okay, first of all, I'm going to openly tell them today that nursing is not just a career to play with. Nursing has to do with calling. If I want to assure you, if you are not
calling to
that field, you will misbehave. Just like a pastor who is not called by God and pretends he was called by God, he will start demanding for money, he will start doing for all these things outside what God is saying to him. You understand? So we have false prophets, and then we have, indirectly I'm saying, we have false nurses because they were not called into the profession and they decided to come. So if you are intending to come into this profession, my advice to you is that you need to tighten your belt. You need to read very well. If you're a lover of all these social media, TikTok, this and that, you cannot cope in school. So not as if we don't do all those things, but we balance it with our academic life. You read more than your play. Though all work, no play makes Jack a dull boy. So we read, we weigh it like 60-50.
You place priority to things you do.
Yes, we make it 60-50. We read 60-40 rather. We read 60 and then play 40, so that it will be balanced. Because nursing is not. I don't want to call up other professions.
Yeah, it's not a child's play because you're going to deal with people's life.
It's true.
Because just as they said, nurse is the backbone of patients. Because yes, they place their lives into your hands. At that moment, you're just like a mini god. So they're trusting you for everything you do, the injection, the drugs, or whatsoever. They're just believing that yes, you're going to do the right thing, and so they're trusting their health, their life into your hands. And so if you misbehave, you do not read well, you do not know what to give this patient actually at this moment, then it's going to be a problem, a time bomb that is going to explode at any time. I'm having a headache, you're giving me a HIV injection. Does it make any sense? I'm having just probably catarrh, and then you're giving me typhoid injection. It's something, so it will now lead to one problem to another, if I am sure, right? Okay, doctor. Yes. So let's be careful, the young ones out there that wants to become nurses. Yes, tighten your belt, just as he said, learn. Because people's lives are going to be in your hands. If you play with it, then, man, you're taking people's life for granted. Alright, so the last but not the least, looking ahead, what changes or improvements would you like to see in the health system? Now that you are into this system, I'm very sure that you must have noticed a lot of things that have been done wrongly, that are not supposed to be done this way, but people are still doing it that way. And so, what are those things that you want? You want a change, you want an improvement.
Okay. Yes, I mentioned something earlier that poverty is a mistake. Yes, then you thought I was joking. I was serious.
No. I didn't.
I was serious about that because
Yes.
If a poor man goes to the hospital, people neglect their level of treatment.
Yeah.
Even if they're queuing line, you come and see that a rich man just rushed in. That means there was no line for him. He just came from his car and then rushed in. Then they give them quality level of treatment. They even have a particular room for them. We call it no, people they call it VIP, but we have a special room meant for all those kind of people. Now you pay huge amount to stay there. Now this is entitled for everybody, but because people are poor, they just look down on them and then. But there's a saying that said, a poor man today can become a billionaire tomorrow. So I'm thinking of it this way. You can look down on somebody and then tomorrow he becomes a billionaire. You're not looking on, how will I cover up all those kind of things. You might not even know this is the person you look down on because they don't notice poor people. They notice the rich people. So that is just it. I don't know how I want to change it, but it's already part of Nigeria that is what they're doing. And then only me alone cannot change it.
You can. So, but you know, with awareness, we can actually push.
Yes, we can do this. All I'm trying to say out there is that we can reduce level of all these things. Everybody are entitled to the same level of treatment.
Yes, so treat every life with importance.
Yes. We don't treat people because they are poor with neglect. You know, they tend to neglect poor people. They don't give them quality care. And I hate that personally because the reason why I'm in nursing is because of the passion I have to serve humanity. Then when I see somebody jeopardizing that moment or playing with that opportunity, I feel bad because this is my calling and this is what I've been looking for. And here am I talking to her.
Alright, please, every life out there is important, be it a rich person's life or a poor person's life. We are all important, and so please learn to treat nurses, doctors, and what again? Pharmacists or whatever. Yes, learn to treat people with importance. Everybody. Because this now moved me to the experience I had. That was, I think, 2 years ago. I went to the hospital, and then I noticed, like, just as you said, there's no line for the rich ones. They will just come and move. And so then one woman, we were sitting there online, then the woman now complained, and the doctor now said, no, this one has come and left. Though. I was like, we came here since morning, so when did this person came here? And so the person was rich looking, the person's appearance, you know that, yes, this person is actually well-to-do. And then we were just sitting there waiting for that person to go and finish whatsoever he wants to do to go. And then we that are still on the queue to go, for us to be go and attended to. So, which is not nice. Someone may have an issue that is very, very critical, that needed attention at that moment, but you neglect it simply because a rich man came with headache. So please, let's treat every life out there with importance. Alright, so thank you very much for having you in here once more. And of course, we have come to the end of this beautiful program. Weekend Gist with Rachel Langs on Haskell TV. And please do well to join us next week, the same time, the same station, for another beautiful edition and something for you to learn to take on with. And of course, stay tuned to our subscribe program. Don't go anywhere. Don't switch that channel to another one, because Haskell TV is going to give you all that you need at this moment. Alright, my name is Rachel Langs, and it's a goodbye from me.
Nice divine.
Alright, it's a goodbye from us. Happy viewing.